evening, friends. This Indian Academy of Orthopaedic Surgeons instructional course video is about the common shoulder issues that plagues us these days. This patient was diagnosed as an impingement syndrome as his abduction could not exceed 90 degrees. He had a fall, a graded tuberosity fracture which was treated non-operatively. He had a stiff shoulder, and the patient is in Chennai. I'm in Kerala. I did a video consultation and instructed my nurse to inject alpha 1 and alpha 5 portals. Only 0.5% xylocaine and clonidine were used. The video shows the injection process, the sites, and the final functional results. Final movements 20 minutes after injection. Those interested in buying the pain portal book or doing the DSCB course can contact me. This was the patient's X-ray showing osteoporosis, reduced joint space, and this was the maximum abduction possible during radiography, and it was diagnosed as an impingement syndrome. Here is the patient pre-injection, and this is the maximum amount of abduction he is able to do. He has difficulty in taking his hand to the mouth and eating. He cannot touch his ear. He cannot scratch his back. He cannot wash his hair. The alpha 1 portal is in the first web space in the intramuscular level. Now, as the patient is recovering from abdominal surgery, I think prostate surgery, my nurse has gone to his house to administer the injection because I did not want to call him to the hospital in the COVID times. You can see from the transparency of the injection that no steroid has been used, only 30 microgram clonidine and 0.5% xylocaine, 3 milliliters have been used. Alpha 1 portal first web space and alpha 5 portal is in the belly of deltoid muscle in the midshaft level of the humerus, goes deep intramuscular. Just as we give a normal IM injection, B5 portal can be varied either in the triceps belly or in the deltoid belly depending on the pathology of the patient. Remember, this patient was advised arthroscopic adhesiolysis and work by 3 surgeons and a reverse shoulder replacement by another surgeon. Even as the second injection has been given, my nurse has asked him to keep the hand high up to see whether the injection, basically the previous alpha 1 injection, is giving him enough pain relief to allow him to lift his hand. And you can see that the movements are indeed a little painful. This is a maneuver which she did on her own. This I normally do not do it at the time of injection. I wait for about 20 minutes and then allow the patient to start his active movements. After this, we made a video call, and because he has been able to lift his hand once, he is able to touch his beard, he is able to touch his opposite ear, and already a smile has started on his face. He has later sent me a voice message saying that this has been a real miraculous treatment for him. We waited for about 20 minutes and the patient now starts moving his hand. You can see how he is moving it. He is able to get it up to 130 degrees, a little pain. He rotates, adds flexion, uses the other hand. This is this patient now after 25 minutes, full abduction, raising the hand above his head, absolutely pain-free, extremely satisfied, and clearly says that all his pain has gone away and that his left shoulder and right shoulder are functioning almost identically. After the treatment was over, the patient sent me a voice message saying that, Doctor, I never expected this amount of miraculous relief from a simple injection. What sort of injection have you given? And what magic or what miracle have you done? The fact that I was in a different city and just by instructions, my nurse could treat him and dramatically improve both his elbow stiffness and his shoulder stiffness and increase his movements to near normal within 20 minutes was so miraculous for them that the patients could not stop believing what they had seen with their own eyes. If you want to learn these techniques, please message me on WhatsApp and I shall send you details of membership of the Indian Academy of Orthopaedic Surgeons and also about how to join these courses. In this, only 0.5% xylocaine and 30 micrograms of clonidine were injected into alpha 1 and alpha 5 portals, and the phone number is given here in this slide, which you can keep in mind as it closes. Thank you.